Hi, welcome. Today's viewer question is, Irvi, my weight isn't fluctuating, but I'm getting new stretch marks. It's really frustrating, especially because I'm in my 20s. So it's not because of growth spurt or old age. So first, let's briefly go over what a stretch mark is. It is exactly what it sounds like. It's a stretching of the skin beyond its capacity to hold together. Now, there's really two main causes of stretch marks. One is our skin is being stretched beyond its capacity by force. So this could be through swelling, weight gain, growth spurts. It could be from bodybuilding. So building very, very big muscles might cause that. So if you get a boob job that's very robust, that might stretch out the skin and cause stretch marks. Pregnancy is a huge cause of stretch marks. And the other main category under why we get stretch marks is due to genetics. So the loss of collagen in our skin as we age. After the age of 20, we lose about 1% of collagen production in the skin every year. So it starts very early on. So collagen reduction in the skin isn't something that happens, in our 40s, 50s, and as we age, as we get further down the line in our age, it actually starts very, very early on. So some of the more common reasons why people might be getting stretch marks, even though there's no apparent cause for them, you mentioned that there was no fluctuation in weight, but you didn't specify if you're overweight or not. And that is a factor. So let's just say this may not apply to you, but it might apply to somebody else who's watching this. So this is a common thing, is if you're overweight since you were very young, you're still stretching out the skin beyond what it's meant to be stretched out to, right? Our skin has a little bit of give and take, but it has its limits. So let's say you've been overweight since you were young, and now that we're approaching our 20s and beyond, that's when our collagen levels start to go down slowly. Genetics plays a role in how fast or how slow this happens. So it could just be that maybe your collagen levels are dropping quickly over time, and your skin, which is stretched out beyond its capacity, now those two factors are converging, and that is what's causing the formation of stretch marks out of the blue. I know it sucks, but it's just how things go. That doesn't necessarily mean that you're extremely obese. It could just be that you're overweight, but maybe your skin isn't that elastic to begin with. So there's all these little nuanced factors that can be contributing to this. And like I said, it doesn't have to be extreme for it to occur. That's just how genetics work. Now, there's other factors that can influence the collagen and the elastin in the skin that's really responsible for how elastic our skin is and how well the bonds in the skin hold together over time. One of those things is high levels of stress over a long period of time. Stress produces the hormone cortisol in the body, and when that happens, it wreaks havoc in a million different ways. A common way that it does is it breaks down collagen and elastin. That's why you see people who are over time who have been subject to a lot of stress. They tend to look older, they tend to have more wrinkles, and that is a huge contributor. Even when their diet and all this other stuff is okay, if they have a lot of stress in their life, it tends to show in the skin. But that's because the hormones that stress brings on break down collagen in our skin, and we lose the bonds that hold the skin together. So that could be a contributing factor to stretch marks. Another thing that could be causing this problem is you could be nutritionally deficient. Vitamin C, D, E, zinc, and proteins, these are all building blocks of our skin. And if those things aren't present in our diet, or if we're deficient in them, that causes deterioration of the collagen and the elastin bonds in our skin, and it can make our skin very weak and brittle. So that could also be a contributor as to why you may be getting stretch marks. It could be dietary deficiencies. Another factor that could be contributing to the breakdown of the collagen and the elastin of skin is the prolonged use of steroids, both topical, so creams, and medications. These are used for a variety of different reasons, but sometimes prolonged use can weaken the collagen in the skin and make the skin very fragile, therefore more prone to stretch marks. So even if you never got them before, it could be causing them now. There are rare instances where there's certain genetic conditions that might be causing someone to get stretch marks, even though there's no apparent cause. Maybe you've never had symptoms before. You may not even be overweight. Actually, sometimes people who are what's considered in a normal weight range or even below that sometimes might get stretch marks because some of these conditions make the skin so fragile and so prone to damage that weight is not even a factor in them at all. Three conditions that are quite common that cause stretch marks without any seeming cause is Cushing's disease, Marfan syndrome, and Ehlers-Danlos syndrome. Cushing's disease is caused by an overproduction of cortisol in our system, which is actually a stress hormone. It's often triggered by use of medications for things like asthma, lupus, arthritis. It could even be from injections that you might be getting for joint pain and back pain. It could even be caused by, as I mentioned previously, steroid creams or steroid medications. So with Marfan syndrome, it is a genetic condition that limits the ability of the body to produce proteins that are responsible for the connective tissues in the body. The symptoms for this syndrome are very, very varied, and some people may not even have an onset of the symptoms until later in life, and there may not be any obvious signs. And the best and only way that people get tested for this syndrome is through a genetic test. Ehlers-Danlos is a group of disorders that affects and weakens connective tissues in the body, such as tendons, ligaments, skin, blood vessels, even organs. And what it is essentially it's a disruption in how collagen is produced in the body. And this causes a lot of weakness in the bonds of collagen. So you get very fragile, very weak skin a lot of the time. And again, even with this disorder, the symptoms of it are very varied, and some people may have early onset and some people may never even discover that they have this if the symptoms of it aren't very intense. Some people may never have any symptoms at all and they may go undiagnosed. And again, with this disorder, you would have to see your doctor. They would have to take down your history, symptoms you've had, and they'll likely order a genetic test. Some imaging might also be done to look inside the body and really kind of assess how things are going. While there are a lot of different causes of stretch marks, 9 out of 10, it's nothing other than aging, lifestyle, nutrition choices, and just an unlucky draw in terms of the collagen production in our skin. And those things we can do limited things about. And then there's a few instances, very, very rare, where it might actually be a genetic condition that could have some serious consequences. And if you're concerned about those things, go see your doctor and get tested for them. Even if you're not concerned about the genetic disorders, even if it's maybe like a vitamin deficiency, just popping a vitamin isn't going to do anything for you. The best thing you could do is maybe go get a blood test to see if you're actually deficient, if you need anything. You know, it could be an imbalance of some sort in the body that's wreaking havoc. Even stress, you know, sometimes we may not feel the effects of stress because maybe we manage it really well, but that doesn't mean that it's not causing harm on an internal level, that it's not disrupting our hormones, how our proteins are built and assimilated through the body. The best advice I can give you, if you are concerned, is go see your doctor. First and foremost, get a simple blood test, start with that, tell them your symptoms, and be very, very, very wary when you're doing Google searches on these conditions. Because like I said, I think if we all Googled right now any one of these syndromes that I mentioned, we could all probably say, oh my God, like I totally am afflicted by that. But they're very, very rare conditions. And it is more likely that it's just a little bit of lifestyle tweaking that can help prevent. Now, the other thing that I want to mention is, as far as treatment goes, there's a few preventative things you could do, like using a really good moisturizer to try to help keep the skin supple and soft and as possible to prevent things from getting worse. But as far as treating them, there's nothing on the market that could help do that. That wouldn't naturally happen anyway. So now there are some treatments like laser treatments, microdermabrasion, retinols and all that stuff. But at the end of the day, all of those things, all they do is just reduce the redness in the stretch mark and just gets it to where it will get naturally, which is just lighter. That redness will go away over time. It'll just help it get there faster. So you're just going to be spending money to fast track a process. You will never be able to eliminate the stretch mark. Once it's there for good. The only thing that you'll be able to do to it is reduce that redness, which makes it that much more obvious. Look at my arm. I don't know if you'll be able to see it in the video, but I have stretch marks like all down my arm. But you can't really see them. And you know what I did for it? Absolutely nothing. I just let time do its thing, and over time they just got lighter, and that's it. So if you listen to dermatologists even, they'll say, oh, there's these treatments, but it's never going to be eliminate stretch marks or disappear them or this or that. The claims are always going to be along the lines of help eliminate signs of, help reduce visibility, right? You're never going to be able to eliminate them. You're just going to be able to fast track the process of healing the tear. And that's the thing, when a stretch mark happens, it's a tear in the skin. It's a stress. And the redness is the blood vessels and all the blood rushing to that area to heal it. And when that healing process takes place and it's finished, then those blood cells kind of go away from that area. And that's when the stretch mark becomes more like whitish and that redness goes away. It's because it's done the healing process, right? Like if you cut yourself, you're going to bleed and you're going to be red there for a while until it heals. And when it heals, it's going to be more skin tone. Same thing with a stretch mark. That's why it gets red. And all of these treatments that are sold to people, all the creams and all of that stuff, it's really just to fast track that healing process. So I hope you don't get taken by that stuff. If you want to, like if you can afford it and if you want to go down that road, I mean, sure, why not? It may or may not work. You know, different things work for different people, but at the end of the day, you're just going to fast track the healing process. You're not going to get rid of that stretch mark ever. The best thing to do for a stretch mark is just to learn to live with it. I mean, I have stretch marks on my belly, on my legs, on my arms, like from here to here, my back, everywhere, my hips. I have stretch marks on my stomach, despite the fact that I've never even had kids. So they're everywhere. And for me, it was caused by obesity. There's nothing I could do about them. So the best thing for stretch marks is confidence. It is likely that something like 80 to 90% of the population has at least one stretch mark on their body. More people have it than not. I really don't think it's anything worth getting worked up over. A lot of our insecurities about stretch marks don't come from us. It comes from marketing, mostly marketing. Because in real life, people don't really care about that stuff. It's when we're constantly bombarded with these airbrushed, perfect photos, filters, and all of this nonsense. When we're constantly bombarded with that, it makes people think that this is normal. And then they have these expectations of this unattainable beauty. Beauty, I say. But it's all BS. And now more and more you see magazines trying to put like that natural skin look. And even those pictures half the time are airbrushed for imperfections. They're just like reduced to maybe 50%. So they're still airbrushed and then try to pass it off as like natural skin. Honestly, the best thing you can do for your own well-being is work on your confidence, become strong and know who you are. Make sure you take care of yourself, whatever that looks like. You take care of yourself, reduce your stress levels, eat well so that you get the nutrition you need. See your doctor if need be, and that's it. And just focus on being the best version of yourself. At the end of the day, that's all that really matters, is for you to be content. Who cares about what other people think? I hope that answers your question. And more than that, I hope that you don't stress too much about it. I just hope that you put yourself and your well-being first and foremost, and then all the aesthetic stuff. We all like to look good and have nice ideal skin, but you know what? That's not the case for 95% of us, and it never will be. And even those with the perfect skin, I guarantee you 99% of those people don't feel as great about themselves as they pretend. And because social media landscape changes every day, you never know what might happen. So make sure you subscribe to my newsletter so that we can stay in touch on our own terms. Like this video if you learn at least one new thing. Make sure to subscribe to my channel for more videos on how to live a more confident and informed life. Thank you for watching all the way through. I will see you next time. Bye.